So welcome everyone, thank you very much for joining us for our panel on social impact bonds. I must admit that when they told us we would have the Friday morning slot, based on my previous experience of the Thursday night SOCAP festivities, I did kind of wonder whether there might be more people on the stage than in the audience. So well done to all of you for making it here. The hardcore, congratulations, looking bright-eyed and bushy-tailed. So my name's James Taylor, I'm from Bridges Ventures, and we're here to talk about social impact bonds, or pay for success, as I believe you typically call it here. So apologies if I keep forgetting that all the way through the panel. Now, before we kick off, I'm just going to show you two very quick slides by way of context, just to kind of frame our chat. So this slide, which is courtesy of my esteemed colleague Laura here. So this is kind of where we're at the moment. So 60 of these things around the world, 200 million raised, 90,000 lives touched. So I guess what this is hopefully showing you is that this is not just a theoretical concept anymore. This is a real thing that we can talk about and analyze and look at the results of. By contrast, this might be a bit small, so I don't know if you can see it. But just to kind of take the UK as an example, which is obviously where I'm based, and we've had more SIBs than anywhere else. So during the last Parliament, we think the government spent, on average, about 730 billion a year, and about a third of that went on what we call kind of human services, and about a third of that was outsourced to external providers. So we reckon about 3 billion of that was allocated to outcomes contracts, and about 20 million to social impact bonds. So this is still a really tiny sliver of public sector commissioning. So I guess I want to focus on two questions today, really. How do we make these things work more effectively and more consistently? And then how do we make them work on a more meaningful scale? So I'm fortunate enough to have a great panel of practitioners here to talk about their own experience. So I'm going to ask each of them in turn to introduce themselves and tell you a little bit about their own involvement in the space. So Laura, do you want to start?
Hi everyone, I'm Lara Metcalf. I'm a managing director at Social Finance. Social Finance is a 501c3. We're based in Boston with an office in Austin, and in early 2017 we'll open in the Bay Area. And we're dedicated to mobilizing capital to drive social progress. The way that we've expressed that mission or pursued that mission for our first 5 years has been solely through creating and advising on social impact bonds or pay for success projects. Our sister organization in the UK, if you're familiar with the social impact bond market, you may have heard of the Peterborough Prison Social Impact Bond, which was the world's first social impact bond that Social Finance UK did back in 2010. And we're really excited to be here. We've seen incredible growth in interest in the space here in the US, and really right now we have 10 deals under development. We have 15 advisory projects we're working on, and our hope really is how do we make this better, faster, easier for government to do so we can do it at scale, and how do we make sure we are creating products that funders want to invest in on the back end.
Good morning, am I on speaker? Okay. Good morning, everybody. I'm Andy Phillips from Make Home Capital, which is a new impact investing platform where I'm launching a fund targeting social impact bond or pay for success financing transactions. Before launching this new endeavor, I was at Goldman Sachs, where I led Goldman Sachs investments in social impact bonds and pay for success, including the Rikers Island deal, which was the first transaction done in this country, and first one done ever by a major financial institution. While at Goldman, I also managed a social impact fund that also invested in social impact bonds as well as other community development projects. So it's great to be here and have this very practitioner-focused conversation.
Hi, is this working? Oh, Hi, I'm Yelena Danziger. I'm with Third Sector. We are a nonprofit advisory services firm dedicated to accelerating America's transition to a performance-driven social sector. So we have 3 offices right now throughout the country in San Francisco, Boston, and DC. We've been working on pay for success projects for the past 5 years, helping governments define outcomes of interest to them and thinking through ways of linking data they're already collecting to those outcomes through performance-based contracting, all in an effort to allocating the resources in more performance-driven ways. So the focus is really twofold. One is to get government spending to be more efficient and outcomes-driven, and to also get the population that is most in need to get better outcomes, as well as the interventions that they need the most. We have launched 3 projects throughout the country, all in the US, and we have dozens more in development right now, so we've learned a great deal over the past 5 years. My personal projects that I'm involved with right now are all focused on youth workforce development, which is a really exciting opportunity right now, given Congress's authorization of Workforce Innovation and Opportunity Act, or WIOA, which has essentially made pay for performance an allowable payment. An allowable use of funds, allowing local workforce boards to allocate up to 10% of the funds they receive from the Department of Labor to performance, so pay for success programming, essentially, which is really exciting because that makes that allocated funding no-year funding, and that means it can be used to pay for longer-term outcomes. So when we talk about lessons learned over the past 5 or 6 years, it's not just about the lessons learned by us here who've been practicing this for the past 5 years, but also lessons learned by the government, by Congress, by the Department of Labor, Department of Education, et cetera. So something really important to keep in mind.
Okay, good morning. My name is Gonzalo San Martin. I'm regional manager for Latin America at Instiglio. And in Instiglio, we advise forward-thinking aid agencies, donors, and governments to define strategies to use result-based financing in order to tackle more complex social problems. We have been working on this almost for the past 5 years, and our focus, and that's how why Instiglio was born, was to take all these instruments well used in developed countries and apply them in developing countries with more complex contexts. So we focus in Latin America and in Africa, and we got to design and implement the first impact bond in a developing country in India with Educate Girls. And currently we are working in the design of a social impact bond in Colombia in workforce development with the support of IDB, the Inter-American Development Bank, and the Swiss Cooperation. So it's great to be here to share experiences and lessons with all of you.
Okay, thanks everyone, and thanks particularly to Yelena, who was last minute swap in, so thank you for doing this at such short notice. A little bit about Bridge's own involvement. For those of you who aren't familiar with Bridges, it was one of the first specialist impact investors, founded in the UK in 2002. We were an early investor in social impact bonds, building on the work of our friends at Social Finance. And since 2012, we've invested in 13 separate social impact bonds, and also raised the world's first dedicated social impact bond. So I want to start, if I can, by talking about what we've learned about where this kind of contract is most effective. So Laura, perhaps we can start with you. Clearly, Social Finance have been involved with this since day one. How has your thinking evolved about where these things work best? What kind of characteristics or features are you looking for?
Yeah, that's a great question. You know, I can answer this 2 ways. So at a really meta level, some form of pay for success can work in almost every part of at least what we do here domestically in the U.S. right now, some of you may have read Peter Orszag's book. He's former head of the CBO, Moneyball for Government, and it talks about how the federal budget includes about $800 billion a year that are going to social services. We only measure whether about 1% of that had the impact it was intended to have. Now, I'm sure it's much higher than 1%. Like, there are lots of good programs and doing great work out there. But the fact that we're not measuring what happens to that money is really, at some level, from a taxpayer perspective, kind of shocking, right? So at a meta level, I think there could be broad use of outcomes-focused finance tools across a lot of the spending that we do at the federal government level. On a more practical level, though, because that's why we're here today, and honestly, you know, we're trying to grow this market, and so we have to start where it makes the most sense. We look for a variety of things. We want a government who actually can define a social challenge that they want to make progress on, and the outcome that they want to achieve. So how are they going to measure their progress? We need, you know, the second part of that is, do they have data, or can they capture data to help measure whether those outcomes are being achieved? Do we have evidence-based interventions and service providers who we believe can make progress on an issue? That's really important, right? This is definitely, pay for success and social impact bonds are part of this evidence-based policy movement. It's really core to what we build on. That's not to say you can't use this in innovative settings, but certainly in the US, we've been very focused on scaling what works. And so are there service providers that have a codified program model that have been rigorously evaluated in the past? So we have good faith that if scaled up, that they can achieve the outcomes. And then at the heart of it, we do a really deep cost-benefit analysis, and it's not only about savings to government, but value to government. And when you do all that work, is there an investable opportunity there? Like, is there a positive ROI? And then finally, the most important thing is, you know, and I kind of looping back to where I started, is there an engaged payer? So is there a government who's willing to enter into an outcomes contract? We have lots of wonderful conversations with amazing nonprofits who have high degrees of evidence, who want to diversify their revenue streams by doing pay-for-success projects, and that's wonderful and that's great, and we love to meet those interventions, but unless there's a government that's willing to pay for the outcome that they achieve, these projects can't get off the ground.
Gonzalo, can I come to you, and can you give me a sense of whether the same things hold in developing markets?
Yeah, we share pretty much the same idea of what is needed in order to have these instruments make the most at the highest value. Now, probably in our case, working in developing countries, the main challenge is generating evidence, or we say we perform in low data environment, and that is one of the main challenges. So how we go around that is, at this stage, we feel shaping maybe where the opportunities are. So workforce development seems something that is working well, but we are at very early stage overall, the sector. We're learning still to identify opportunities in other sectors as well. So data is one important thing. And the other factor, probably, we need to think about the goal. What is the objective of an impact bond? What is we want to generate? In developed countries, probably the cost saving is a strong case many times, because governments are already spending a lot of money. You were mentioning figures now. But in developing countries, we are at in many cases, a different stage where probably governments are not spending enough. So the saving case might not be the right one. So cost effectiveness is probably one of the main goals, and if we need to also identify the opportunities in order to make the sector grow, probably giving priority to simplicity, to the first experiences and pilots will be critical as well. So going back to the question, I think.
Okay. I think one of the interesting things we're starting to see in the UK is that we're increasingly using these things as a way to make current spending more effective, rather than trial these new approaches that require lots more communication and we don't kind of know what we're trying to achieve necessarily. Is this kind of different from the way that SIBS and Pay for Success have been used to date, do you think? And is that a suitable role for SIBS to play? Andy, maybe?
So I think early on, and I think back to the first investment that was done in the US, which was around addressing the issue of recidivism among adolescents on Rikers Island, which is the New York City jail. And it literally is an island for those of you who've not been there, which I hope is most of you. And it is a pretty grim place. And so that was a case where New York City had identified an issue sort of broadly in the city where young men of color were not succeeding at the rate that their white counterparts were. And one of the things they identified that was a real concern was the disproportionate number of young men of color who ended up incarcerated on Rikers Island. At the time when we did the investment, 50% of those kids were coming back to jail within a year of being released. Someone there just winced, so that's a scary statistic. Here's a scarier one. 90% of them hadn't been convicted of a crime. So these are kids who weren't able to make bail. In the time since we actually made that investment, there was a New Yorker article about a young man who ended up in Rikers for 2 years, spending a lot of time in solitary confinement for stealing a backpack, who ultimately committed suicide. So obviously a really challenging issue. And this was a case where the city wanted to figure out how to provide better supports to those young, primarily young men. And so it really was a new effort where we were taking a curriculum that had been used broadly in other places where there was a significant amount of research on the impact of cognitive behavioral therapy and bringing it to Rikers Island. So it really wasn't this scaling up. It was really more about an innovation in that we were doing it in a location. As most people know, what happened when we looked at the evidence on that project and the impact on recidivism is, in spite of the evidence, and we still stand by our underwriting of that deal, there wasn't the hoped for effect on recidivism. And I think since that time, broadly in the US market, one of the learnings has been that these are better instruments for taking a program that's been operating where there is an evidence base and scaling it up. Because I think what we've learned is that replication, although there may be good evidence, you may face implementation challenges, or, as is I think the case at Rikers, you may face an environment with some unknowns that couldn't be accounted for. So the good news of that story is that what ended up happening was the program was shut down. And I don't know how many people here have been involved in the social sector, but I've spent the greater part of 30 years involved in the social sector, and I have yet to come up with another program that I know of that was actually shut down. And so in a sense, we've always made the claim, we've always posited that while the intervention itself wasn't successful, what that transaction points to is how effective this public-private partnership and financing and contracting approach, how effective it is together to holding government and service providers and all of us accountable to those results and making decisions based on it.
Okay, well, hopefully we can tease out a few more details about some of why this intervention didn't work as hoped as we go along. But I just want to give Yelena a chance to comment on this original question. Should SIBS be about catalyzing new spending, or should they be about making current spending more effective?
I think the goal definitely is to make the existing spending more effective. As you mentioned, over $700 billion is being spent by the government, as opposed to the 45 billion or so spent by the philanthropy. So the money that's being spent, the majority of the funds are being spent by the government, and it's certainly the goal is to get those funds to be all of them or most of them more outcomes oriented. And this is one issue that actually gets bipartisan support, so we can get there. Right now, between as I mentioned, the WIOA being passed as a collaboration between both the Department of Labor and Department of Education, and the Social Impact Partnership for Pay for Results Act in Congress, and the numerous notices of funding availability that are coming out right now for all the different pilots and feasibility studies to be done to try to implement pay for performance or pay for success projects out there. I think it's clearly now there's a momentum to try to get the existing funding out there to be more outcomes oriented, as opposed to bringing in new funding.
Okay. I want to wade two-footed into another big debate in this area, which is around how we evaluate or validate the success of a particular program. So clearly there's a school of thought in this field, and some of you may have seen the Urban Institute paper last week, which kind of argued along similar lines, that you can't really assess the performance of these things unless you have a proper, full RCT, a randomized controlled trial, because without it, you can't properly tell how much of an improvement this particular program has made, as opposed to other extraneous factors. And thus, without the RCT, you can't put an accurate value on outcomes. Now, I guess we would argue a couple of things. One is that if you're focusing more on driving improvements in existing services, where you have a better idea of what outcomes you're currently getting and what they're costing you, it's a bit easier to quantify the value of a particular outcome. And then, I guess also in practical terms, if you do this, it's going to be much slower and much more expensive to build these programs. Laura, where do you stand?
Such a great question, and it really is, for those of you that are new to this world, it is the kind of critical debate that's happening in the field right now. And so, look, the projects we've launched to date and the projects we'll launch this year all will have randomized control trial as an evaluation method. And we love those projects, and they're high quality. But here, at the end of the day, when you add a research agenda into the way a financing mechanism works, that means you're diverting large amounts of money to pay for an evaluation. A randomized control trial is often upwards of $1 million. So, that could be 10-20% of your program costs going to evaluation. And while we will continue to do those projects, if that's what if government's main priority is to have a learning agenda, we will absolutely serve our clients and do those projects. But for me, what makes me excited about this is the possibility of doing things at scale, right? So the 10 projects that have been launched in the United States, I think are going to serve plus or minus 20,000 people, and that's great. But in a country of 300 million people, I mean, I think we all have, everybody in this room has a scale aspiration of some kind, right? And so for me, what makes me excited is, what are the other outcomes-focused products that we can offer as a field alongside the beautiful little jewel box randomized control trial projects that we're doing? But what about the government who cares about scale first, who has a really significant large problem that they want to serve an entire city, an entire community with? And unfortunately then, serving 500 families or 1,000 families, while wonderful and important, does not move us far enough or fast enough. And so I'm really excited about other products, and I'm sure someone will talk about the rate card approach in the UK, so I'll pause there. But for me, it is quite clear we have to move to scale, and that means let's have a lot of different approaches that fit the problem that government is trying to solve.
Andy, maybe we can talk about your experience at Rikers.
Sure. So I would wholeheartedly agree with Laura that conflating a learning agenda with the performance management agenda that comes with more of an outcomes-based contract, or what they call in the UK a rate card, I think is one of the barriers to scale. And I think I would make a case, really based on my experience, that if what we're really trying to do is achieve performance management goals at scale, that there are ways to do that that are simpler than a randomized control trial. And I spoke on a panel earlier this week, and I'm going to repeat myself. And so my two trite sayings are this in this space. One is, I don't think we should let the perfect be the enemy of the good. And so while a randomized control trial gives as close to perfect information as we can get, or that's what the researchers tell me, getting there has real costs, both financial and otherwise, and human for those people who don't get the service. My other trite saying is, we don't have to outrun the bear, we only have to outrun the other campers. So right now, we're tracking next to nothing. So what we can try and do is come up with this perfect information approach, which, by the way, I challenge anybody in this room to come up with a business example where everybody acts on perfect information. Not usually the case. And so what I would say is what we need to do is get more outcomes focused, which gets us closer to that performance management.
Is the bear the randomized control trial?
Yes. Thank you. I'm the queen of weird metaphors. Don't tell John Roman. So anyway, I want to give a couple quick examples of this. So going back to Rikers, that was not a randomized control trial, although it was intended to be. But what everybody figured out very quickly was that it was impossible to randomize the population of young people that were on Rikers Island because kids got moved around all the time and there was no way to create sort of two cohorts. So we very quickly moved to a quasi-experimental design. The Vera Institute of Justice did the evaluation. You don't get better than them in terms of criminal justice research. They were the ones who drove the design, so it was one notch below quasi-experimental design. The reality of what happened when we got to the 3-year point where we would have 1-year results for the first cohort of kids was literally the project partners at 6 o'clock in the evening on a conference call with the Vera Institute to say, and this is what we found out. Take a moment to think about that from a performance management perspective. So we had no information for 3 years, and then we opened the present and found out the results. It was good in the sense that we had information and government was able to act on it. So I don't fault any of us for this strategy. And for a lot of reasons, because of all the externalities involved in criminal justice and recidivism, it's very hard to not use an experimental design. What I would say is compare that to other deals where we've had data come out since then. And another anecdote is in the Utah investment we did while I was at Goldman, we financed early education. The first year of results came out a little over a year ago. And what we found is of the 110 kids that were identified as the highest risk, in their first year of school, one of them needed special ed services that was really more remedial in nature. When we sat with the director of the preschool program to tell her those results, her first response was, oh my goodness, I want to find that kid and make sure they're getting all the help they need. She immediately said, I have information, I'm going to make a management decision, not because it's going to drive future payments to Goldman Sachs, but because I care about these kids, and so I want to make sure that kid gets the services they need. I thought that was pretty cool. In another case, we've had deals where we're looking at, again, more sort of rate card or sort of moment in time outcomes, where we've been looking at the data for payment purposes, but what's also happening is the management team is getting data to say, is this what we expected in real time? Should we be making tweaks along the way? As well as, are some of my sort of cohorts performing better than others? And rather than being punitive, using that for continuous improvement. And I think those experiences have really, as well as other experiences earlier in my career managing large-scale performance-based contracts, really has gotten me very bullish on this notion that outcomes-based contracts are a great tool for performance management in the social sector.
I would just want to echo everything both Lara and Andy said. Certainly RCT is a golden standard in the evaluation methods, but it may not always be the right choice. And as we try to move towards scale, as Lara mentioned, then we need to start thinking more about how do we take a step away from trying to build the full Maserati, as I try to think about a full-blown pay for success project, and think about what key parts of that really matter to actually improve outcomes, and what can we let go of. And this is where I think the evaluation methods really start to play a role. So we could still build a Camry or a Subaru, right? It's still just a very good, reliable car, and it certainly doesn't cost as much, and it doesn't take as much effort to build. So just wanted to echo that as well.
Gonzalo, you talked about working in a low data environment. You don't have these benchmarks in quite the same way. How do you get around that?
Yeah, it's a good question. I think I agree with what had been said here, but also performance management is where we also we think it's very important, and we put more attention to that in time. But we go back to my previous point. So in low data environment, we need to be careful about what we can do. What is the goal? What is the purpose of this? No? And we are trying to keep simplicity on things as well, no? Because of the cost and because I don't know, it makes sense. So we are considering in the design phase not only RCTs, but to what extent we can use, I don't know, pay against observed result instead of the high standard, no? And that's what we are trying to do and trying to incorporate as far as we can. But we know if the case is about saving, probably RCT might make more sense. So we are exploring the other alternatives in the work we are starting at the moment, in Colombia, for example. So we don't feel we have the right answer, but we want to explore opportunities, and I repeat, the performance management, we feel it's a must in these projects.
Okay. It kind of leads us nicely onto what this means for providers and the people who are providing these, who are delivering these actual programs. I think we've always been of the view that outcomes contracting has two big benefits for providers. The first is that it gives them the opportunity to adapt and improve the programs as they go along. And the second is that it gives them a big incentive to over-deliver. And that's something that certainly in the UK they haven't had under the traditional fee-for-service arrangements. And I guess with social impact bonds, the benefit is that it kind of allows a group of social sector providers that wouldn't otherwise have the capacity to tap into these big outcomes contracts to play a role in delivering them. Is this the case in the US as well? I mean, what are the kind of, presumably this imposes a particular set of demands on a provider that are different from the ones that they would have had previously when delivering public sector contracts. What are the kind of things that we need to be thinking about as far as providers are concerned? Do you want to take that?
Sure, I'll start. I think a well-designed social impact bond or pay-for-success project actually isn't asking a service provider to do a lot of new things. I think if you selected the service provider well and to meet the need that government has to make progress on a big social issue or social problem, then hopefully the service provider is doing what they do best, actually. And so you've designed the outcomes, or you've chosen the service provider based on the outcomes that the government wanted to achieve, and there's evidence that the service provider can do that. I think we spend a lot of time with our nonprofit service providers that, we're raising capital to help them scale their operations in these projects. We want to make sure they have time to ramp up, that they understand what the requirements of the contract are. If anything, my concerns sometimes come about that the pragmatic side of my brain says, okay, if we're going to have an outcomes-focused contract, you can't measure 20 things. You have to pick 2 or 3 or 4 metrics that you're going to measure, and that's how people are going to be repaid, the upfront funders. To boil down any service provider's success in the world to 2 or 3 or 4 outcomes is not probably a totally accurate representation of what all the good work that a service provider does. And so the other side of my brain occasionally has a little bit of angst that these contracts, at the end of the day, whether one of our partners, for instance, in New York, we work for the Center for Employment Opportunities that deals with a criminal justice population that's been recently released and has great evidence that shows, hey, if you can touch somebody in the first 90 days and get them into life skills and then transitional job and help them get back into the workforce, that their chance of recidivating goes from 70% down to 30%, right? It's really significant life changes and outcomes for that individual and for their entire family, right? But at the end of the day, what we're measuring in that project is reduction in bed days. And did somebody get into a transitional job, and then reduction in the bed days. So that's a way we measure time in prison, right? How many bed days spent in prison. Now, the Center for Employment Opportunities does a million other great things. And so I have to admit, I do have occasional angst. I'm up at night, like, what if the project what if the outcome isn't achieved or doesn't meet the threshold? Is there reputational risk for our service providers? And so I think we really try to talk quite clearly with them about what some of the risks are around this contracting. Now, the other side of my brain, one more side, I'll go back over to my pragmatic side.
You have a lot of brain sides.
Yeah. I was a CFO of a large nonprofit before joining social finance, and having diversified revenue streams is really important, right? And so many nonprofits are dependent on philanthropy and government contracts, right? And so, and the philanthropy might be big grants or it might be individual donors, but we really are offering nonprofits, high-performing nonprofits, access to scale capital in a way that they don't have it right now. It's a diversification of their revenue stream, right? So I think our goal at Social Finance is to just make sure that everyone on all sides of these contracts and all sides of these projects, whether it's the funders, the service provider, or the government, understands what the goals of the project are, what the risks are, and we all have a clear idea of what success is going to look like, and hopefully we get there.
Okay, I'm conscious of trying to leave a bit of time for questions at the end, so I want to push on to something else which kind of seems to be a big difference between what's happening in the UK and elsewhere, which is around the financing of these contracts. So I guess we're used to a situation where we are the sole or the lead investor on most of the SIBs that we invest in. In the US and elsewhere, that hasn't been the case. I guess we're used to it, and we kind of take the view that all the investors come in on the same terms, and they're equally incentivized to do all the same things. That's not what happens in the US. Why not?
Why don't I take a stab at this one, because I think I am the culprit that sort of got that ball rolling in the US. So really what we're talking about is essentially a capital stack or some kind of credit enhancement in these transactions. Particularly in the US context, if you look at community development, where in this country we've been leveraging private sector capital to do affordable housing, mixed income housing, other economic development projects over the last 30 years really successfully. If you look at the underlying financing in most of those deals, there's some kind of tiered capital structure where government or philanthropy is coming in, taking a subordinate position in order to crowd in more private sector and senior capital. Really what I would say is the SIB and outcomes-based contracting market is really just leveraging that structure. And the advantage we have is there's a long history of doing that in this country. And so what that means is, for example, in the investment we made while I was at Goldman Sachs in Utah, we came in with the senior capital at about $5 million. We were able to do that and make that scale of investment, which I know in the scale of investment world is teeny tiny. In this space, a $5 million check is reasonably significant. We were able to do that because there was some downside protection due to the subordinate investment made by J.B. Pritzker. He, as a philanthropist and investor, was comfortable doing that because what he knew is that his investment as the subordinate capital crowded in and brought in other senior capital. And so I think that's where that approach has evolved. So that's the good news part of it, is with that subordinate capital, you crowd in more senior capital, you bring in other investors, because you get it much closer to these sort of risk-adjusted returns that those folks are looking for. The downside of that approach is that the capital stacks can get really complicated, and right now in typical transactions, or in many of the recent transactions, there's 8 to 10 investors. Everybody's taking a relatively small piece of the deal. That means when you're trying to close a deal with all those different investors and all their different counsels, unless, God willing, they actually share counsel, some of them, it adds a tremendous amount of cost, a tremendous amount of time, and a tremendous amount of complexity that I'm not convinced actually makes the deal better. And so part of my motivation for launching this new fund is really to help simplify that. The fund will actually have some subordinate capital on the fund level, but the idea is then to be able to go in on the transaction basis and sort of simplify that execution.
Yelena, what's Third Sector's view on this? Are you working towards a situation where you have fewer investors in the stack?
So certainly over the several projects, things have evolved, and and no two deals are alike. There's really no blueprint for the right financing model. I think the place where we start from now is that financing private funding is not necessarily a given, and once there's a realization that financing may be necessary, we start looking at the right funder to bring to the table. I think the key that some of the changes that we've seen, for example, in our latest Santa Clara project, the lead investor is a CDFI. So there's been a lot of evolution in this space. I think the problem that, Andy, you're pointing out is the more investors you bring to the table, and they each come in with their own process that complicates the project more and more each time. So the thing we need to really focus on is how do we balance out the due diligence process with each funder. So we either need to lower the number of investors at the table or really simplify the process, because the more you have at the table, the more time you're spending and the more resources of the project you're spending on the financing piece of it instead of the project itself.
Gonzalo, is this an unavoidable problem in your market? Is there any way around it?
I wouldn't call it a problem. I would say we're talking about a different setting and environment. The sector is new in the US, in the UK, and is even newer in developing countries. So the level of risk, again, associated to low data environment, and maybe we didn't talk about service providers, but there's a need to build capacity amongst them, etc. So if you consider everything in that equation, we're talking about maybe higher level of risk. So the money that's coming to this deal probably is being more philanthropic money, who are willing to push the frontier, experiment, try new things, improve the model. So then other profile of investor could come. So that's probably the main difference at the moment.
Okay.
Can I make one really quick comment? This is one area where social finance is really working quite hard with our sister organization in the UK and with the Bridges folks' help on thinking about how we bring some of the UK methods of doing these projects to the US. And a big difference from my point of view is not only the capital stack, but in the US, we're asking for a full commitment of capital to fund an entire 4 or 5 years of service delivery. So our projects tend to be between $10 and $15 million capital raises in size. And so that's part of what drives the need for the capital stack and multiple investors. I think you guys have been brilliant because this rate card structure seems to have a faster turn of capital mechanism in it, and from what I understand, really it requires about a third of the capital commitment. So if it's a $5 million or $10 million project, really you're only raising 3 or 4 of it up front, because if the project's going well, that capital's going to cycle. So it's more of a revolving structure, I think, in the UK that makes tons of sense to me. And so we're really eager to try to bring that concept or that structure here to the US.
Yeah, I think we're increasingly trying to build in staggered payment mechanisms as part of the process. So both as it gives early feedback and helps drive performance, but also because it lets us recycle capital and reduces the kind of overall working capital need. I'm conscious we're short on time, so I want to do one quick question before we open it up. The kind of press coverage of SIBS, Pay for Success, whatever you call it, has been not always positive. Does Pay for Success have an image problem? And if so, how do we solve it? You have 1 minute.
I'm going to say Goldman Sachs learned the hard way. I don't know what you're allowed to say, Andy, or what you're not allowed to say as a former person on that project. I think when we focus on the investor rather than the people we all seek to serve, we get into really dangerous waters. And I think people think it's sexy because we're using private capital to drive social progress on these big social issues, and I love that too. But really, we all have to remember, and what we should be talking about is, the person whose life is improved because they're no longer involved in the child welfare system, or because their mom had a nurse visiting them, while she was pregnant and during, the early years of life, so that they had better educational outcomes. And so, for us, we want to keep it focused on the people we seek to serve.
Well said. I will add one sort of referral back to the earlier conversation. What I want to be clear on is, I don't think any of us on this panel are saying randomized controlled trials are a bad idea generally. I think what we're talking about is in the context of a contracting mechanism. Sorry, felt the need.
First-hand experience of SIBS as an image problem. What have you learned anything about how
You didn't think well said was my answer?
See, how do you think the Rikers project was reasonably reported? Do you think there's anything in the positioning that could have been done differently?
What I would say is actually I think the Rikers project was really well reported, and I think that the press was willing to look at that and see it in the nuanced way that we would have hoped they had seen it.
The Utah project, on the other hand, unfortunately, I still get asked about it too. As recently as a night ago, somebody said, well, what about this Utah early childhood? And if people didn't see it, there was a firestorm because the first outcome payment, which was very small and would have been highly predicted to be positive because there are very few kids involved in kind of special needs at the early stage, at 3 or 4, it happens kind of as they get older. But because of the way it was reported all about Goldman Sachs gets money because no kids went to special needs programming, or it was blown out of proportion. So people still ask me, and I always say, no, it's a great program. It's a program that Mayor Ben McAdams already had instituted. It gets more kids into pre-K where they weren't going to have those services. But unfortunately, because of the way the first outcome payment was reported, it got a lot of really negative feedback for Goldman Sachs and sadly for the entire project team.
I would agree with that, and what I would say is I think Laura's prescription is exactly the right one, which is what we need to do is focus on what's happening in communities and why that's important and why it matters to sort of expand access to these high quality services and put in place mechanisms to make sure that they're effective. I think we can't always control the press, but I think we can as a sort of collective try and keep the focus on those social outcomes and why it matters.
We've mainly talked about press here, but what about the way that commissioners perceive this area? Is there government officials and UK term, tomato, the way that government and anyone who's commissioning these projects thinks about these things, is there an image problem there too?
I don't think so. Generally, when we work on these projects, we do find the government champion, and that's key. I think it was already mentioned earlier that when you have that government champion, you can't do a project without one. But when you have the folks on the ground who are both interested in doing this type of work and are incentivized and are truly and deeply involved, they don't think of it as an image problem, and they're certainly willing to go fight the good fight all the way up as high as it gets in order to get the project done. So I definitely don't think so, but I also want to come back to the general media issue where I think folks question the incentives. There's definitely questions out there as to whether the SIBs are truly aligned with impact. And for us, I think the key as a community and as a collaborative is to continually stress that when funding is needed in a project, the private funders that do come to the table have to be impact first, and that's exactly what we look for. This is not a typical investment, and the folks who come are not looking just for a return. So as long as we keep stressing that message that the private funders that are doing this are impact first funders and potentially return second, I think that's key, and we have to keep stressing that message.
Okay, good. We've got around 8 minutes or so left. Any burning questions from the audience? This gentleman here in the blue jumper. I think there's a mic coming. Sweater, sorry. Apparently a jumper is a onesie, which is very confusing to me. Sorry, continue.
Questions around delayed results, specifically in early childhood education, and how you communicate that with governments that might not be seeing the true benefits of the work for 15 or 20 years, maybe particularly directed at Andy.
Sure. I mean, that's a great question, and it's something we talked a lot about in Utah, and again, trying to stick with really practical examples. So the first outcome payer of the first tranche was Salt Lake County, okay? Salt Lake County is not responsible for any spending associated with special education or direct educational outcomes, which leads you to the question of, well, why did Ben McAdams, as the fabulous mayor of Salt Lake County, decide to be the outcome payer? What he did look at was the fact that he does pay for all of criminal justice activity as well as substance abuse problems, and his team really looked at the research that was out there that said, actually, if you get kids into high quality preschool, they actually do better when they're teenagers and are less likely to be involved with the criminal justice system, are less likely to be substance abusers. But what he recognized, again, really, really smart and forward-thinking guy, and keeping in mind this was very early on in this space, was that it would be impossible to tie what happens when someone is 4 to then wait 8 years, or however many years I'm doing, 10, 12 years. Yeah, some of them would be precocious and getting in trouble earlier. Sorry, I have teenagers at home. So it would be very hard to say, okay, what happens 10 years from now? And so what he was able to get comfortable with is, okay, these kids being on track and on grade level is a good proxy that we can look at early on and is observable for them doing well in school, which we believe will lead to the outcomes that we're very focused on. And in fact, I would argue with every transaction, there really is this notion of what is your overarching goal? And then how do you boil that down into some metric that is observable and quantifiable in real time?
Okay, okay. Another question maybe? This gentleman here.
Yes, I was interested in the financial incentives, not just of the investors, but of the agencies that actually deliver the programs. And my understanding from at least the UK examples was that the investors were taking a risk on the outcome, but the agencies were essentially being made grants by the investors. So I guess if you look at the business or capital analogy, usually there's an issue about aligning incentives, in the people that execute programs. Are there examples where, say in America, where there's more free enterprise mentality, where people in social agencies are getting, they're sharing the risk, the actual social agency, and what is the logic of not having, if the idea is paying for success, why do the people who actually deliver the programs, their funding is independent of the success if they're not on some sort of success formula?
So I think you're absolutely right, and I think most of us would agree that's the ideal structure. There is one example where that was the case in the Massachusetts transaction. ROCA, which is the service provider, essentially takes an equity position in the deal. As the equity position holder, they also receive upside on the back end. And I agree with you wholeheartedly that that's the model we need to move toward. The challenge is a lot of service providers don't have the capital necessary to do that. But I think probably most of us would agree that's the direction we want to move in.
I disagree, actually. Sorry. I actually feel like these service providers, if you're choosing highly evidence-based service providers, they have a lot on the line. Like, if this goes wrong, it's going to be really public if they don't hit their outcomes, and that's actually going to endanger their ability to win contracts in the future. And so I'm not against this model, and actually we have an upcoming deal where there's a success payment in the back end for our partner, Jewish Vocational Services, in a Commonwealth of Massachusetts workforce project we're going to do. And if things go really well, they will get a bonus payment. So I like the fact that, so I can get comfortable with that, but I think it's overly simplistic to say that these folks aren't incentivized to achieve because we didn't make them put money on the line.
I mean, the structure in the UK doesn't typically work like a grant. I mean, they have structured payments, so they can get some early payments back during the course of the program, but they are betting at risk, basically. They're still betting on an outcomes payment at the end of the program. And so their interests are aligned with those of the investor, typically. Yeah, but the Career Connect, which is one of the successful ones that has since been recommissioned, but the second time they were recommissioned, they were able to bid at a much lower price because they were then aware of how much it cost them to deliver that program. So they had more information and they were able to change the way that they priced their program. But they're still at risk. Their outcomes payment in the end are still at risk. And this lady here.
Okay, and this is probably the last question.
Hi, can you talk a little bit more about kind of SIBS 2.0 and kind of what you would like to see happen in the next 5 years, and sort of like what the end game here is? Is it to see kind of bigger deals and transactions? Is it to get governments to sort of adopt this once the efficacy of some of these interventions are proven, sort of like moving forward, sort of what would you like to see happen?
I'm happy to start. Or no, why don't you go?
Yeah, in our case, I think what we envision, like, or we talk about like a outcome market, performance market. That's what we like to see. In order to get there in developing countries, we need the support of key players in order to develop the ecosystem. We're talking about players that are not active in developed countries, of course, aid agencies, multilaterals, World Bank, etc. So they are the ones that being invited and taking like step by step, like concrete actions in order to engage, convince government and show the potential that this has for to tackle social problems that have not been solved so far. So that's what we see, a market with stronger service providers, with committed investor with social issues, and also with governments thinking differently and trying new strategies to do that.
Laura, do you want to have the last word?
Sure, I'll just say that I think we envision an outcome-focused government, whether it's local, state, or federal, that where dollars are being driven towards things that achieve outcomes. And so there should be a variety of outcomes-focused projects. And some of them will look like the Pay for Success or social impact bond projects that are happening today. And hopefully some of them will be more like the outcomes rate card approach that the UK is using, where a government says, these are the outcomes we want to achieve. And this is what we're going to pay for them. And actually, it's going to be different for different populations. So the harder to serve populations, if you achieve an outcome, you're going to get paid more. And for a less hard to serve population, you're going to get paid a little bit less. But really where government actually has the data and the ability to say, we want these outcomes, this is how we're going to pay, this is what we're going to pay for them. And then over time, that'll iterate and evolve. And then I'm sure there's 4 projects or 4 products I haven't even thought of yet, or no one has thought of yet. And so hopefully there's a suite of services that fit what government needs to accomplish. And we've got a really large and vibrant impact investing market funding these outcomes. And we're achieving, we're achieving social progress for the people we all seek to serve.
Okay, I'm afraid we're out of time. Sorry we couldn't get around more questions. I'm sure the folks will be sticking around afterwards if you want to collar them on the way out. But if you can just join me in saying thank you to my panel. Thank you very much.
Thank you, James.